Hi, I'm Flo with the Roseline team. Roseline is a new generation AI agent that not only scribes but also calls or texts the patients to perform medical intake across specialties for physicians in order to save them valuable time. So I'm going to show you an example. I'm going to call Roseline and play a patient that has knee pain and swelling who's been referred to an orthopedic surgeon. And then Roseline will do my intake. All right.
Hello, my name is Roseline AI, and I'm a physician assistant. I'm here to ask you some questions to help the doctor prepare for your appointment. Could you please tell me what brings you in today?
Yes, I've been dealing with really bad knee pain, and it's been swelling as well ever since I injured myself a few months ago.
I'm sorry to hear about your knee pain. Let's get more details to help the doctor understand your situation better. Could you please tell me your age and let me know if you identify as male, female, or another gender?
I am 38 and I identify as a male.
Thank you for sharing that. Let's talk more about your knee pain. When did the pain and swelling first start? And could you describe the nature of the pain? For example, is it sharp, dull, throbbing, or something else?
Yeah, so it started about 4 months back during a soccer game when I twisted my knee. So the knee is always swollen and stiff. So it feels like it locks up sometimes, and I just cannot bend it properly. And so it's I don't know. I would say it's a sharp pain every time I move.
Oh, it sounds quite uncomfortable, especially with that locking sensation. Have you noticed any specific activities that make the pain worse or better? Also, does the pain occur at rest or only when you're moving?
So it definitely gets worse when I walk, when I climb stairs, or if I even sit for too long in the same position. When I try to stand up, then it really hurts. Um, it's also fairly constant. There are moments where it eases up a bit if it's at rest, but it's pretty constant.
I can see how that could impact your daily life. It's important to address that. Have you tried any treatments or remedies for the pain and swelling so far? If so, have they provided any relief?
No, the only thing I've tried is to rest. I did a little bit of physical therapy as well after the injury, but frankly, it just didn't help.
It must be frustrating not to have found relief yet. Let's discuss your past medical history. Have you had any previous injuries or surgeries on this knee or any other joint? Also, do you have any other health conditions that might be relevant?
No, nothing that I can think of when it comes to relevant past injuries, and I really never had any knee pain in the past before that injury.
Got it. It's helpful to know this is a new issue for you. Now, let's discuss your family history. Is there any family history of joint problems or conditions like arthritis?
Yeah, my mom did have arthritis. I didn't think that would be relevant, but then no one in my family has had problem like this.
It's good to mention it, as family history can sometimes provide useful information. Now, let's talk about your social history. Could you tell me about your occupation and if you have traveled anywhere recently?
Yeah, I mean, I work in AI, which means I'm mostly sitting on my desk on a daily basis. I don't do any heavy lifting or anything like that, so I can still work, but it's still problematic. I didn't do any travel recently. Um, I used to be quite active, but um, it's kind of slowed me down in terms of doing sports, obviously. But nothing, you know, nothing else unordinary.
I see how your knee pain has impacted your activity levels. Let's discuss your medications. Are you currently taking any medication, including over the counter pain relievers or supplements?
I mean, I try not to. If the pain is too strong, particularly if I want to get some sleep, I might take a Tylenol, but that's it.
Understood. That's good to know. Lastly, do you have any known allergies, especially to any medications or substances?
Nope, nothing I can think of.
Thank you for providing all this information. Before we finish, is there anything else you'd like to add, or any other health issues or symptoms that concern you?
No, that's it. Nothing else.
Thank you for your answers. The doctor will review them prior to your appointment. You may hang up now. Take
Okay.
care.
Thank you. Okay. So that was an example of a medical intake with Roseline. As you've seen, I've added on the screen what the physician gets within the app, which is a detailed summary of the conversation between the patient and Roseline, ultimately saving him or her a lot of time. So we made this version fairly short for the demo of the intake, but we're able to customize the depth, the thoroughness of the intake, and also customize it entirely in terms of the intake itself and in terms of the summary, based on the specialty and even based on the physician. So if you're interested, feel free to reach out to us. We'll be very happy to share some more. Bye-bye.